Mother Knows Death, starring Nicole and Jemmy and Maria QK.
Hi, everyone. Welcome to Mother Knows Death. On today's episode, we're going to talk about Nicole Polizzi, otherwise known as Snooki, and how cancerous cells were found in her cervix. An older story that's been circulating online this week that we must have somehow missed back in September about Elton John turning his kneecaps into jewelry. I don't know how we missed that, but we need to talk about that. There's a new infection the CDC wants us to panic about that is called a flesh-eating parasite, and we'll talk a little bit more about what that is. A teacher who is being sued for throwing out a kid's amputated fingertip. A firefighter who bludgeoned his wife to death with an axe after reading her diary. And a woman in Canada who was euthanized against her will. Wouldn't you call that murder? I don't know.
Yeah, exactly.
We'll finish up the episode with your question, comments, and emails, all that and more on today's episode. So let's talk about Snooki.
So Snooki went on social media and revealed that she had an unusual pap smear and doctors had found cancerous cells on her cervix.
So this is what I think happened based upon her interview that she did. It seems like she got a pap smear within the past couple of years that was abnormal, and they said you need to come in and get a biopsy done to figure out what's going on here. So let's start off with that first. I used to do this for a living, so I know a lot about this. Before I was a PA, I was a cytotechnologist, and that was what my undergrad degree was in. So I used to look at pap smears all day long as a job. So the reason that they do a pap smear is because in your uterine cervix, there is a level of high activity that could happen if you get an infection with a virus called HPV virus. So the HPV virus is human papillomavirus, and that is a virus that is sexually transmitted. And some strains of it that are higher risk can cause cells to become abnormal and can become cancerous. So this area of the uterus where there's high cellular turnover and activity is where the cervix of the uterus is, up at the top of the vagina, and where it starts to transition and go up into the uterus. So at that point where that transition area is, cells can become abnormal. And when you do a pap smear, you're scraping those cells to see if there's any changes that can be considered abnormal that may eventually lead to cancer. So back in the day, this Dr. Papanicolaou, he figured out that by screening women, you would be able to catch the cancer before it turned into invasive cancer. So you would see the cancer when it was precancerous, which is why we're always having to get pap smears as women now, because it really has lowered the chance of us getting cervical cancer. And now, especially within the past, 20 years or so of testing for the actual DNA of the HPV virus to see if you have one of these strains that are considered to be high risk that would cause you to get cancer. So she had this done. And the first step is we look at the pap smear and we look at the cells and can see if they're abnormal. Now, sometimes they just look a little funny and you're like sometimes if you have a yeast infection or something, the cells could look a little funny. Other times it's pretty obvious that they're really angry and they could potentially be precancerous cells. But it's not an absolute diagnostic. So it's a screening test. So the next thing would be to look at the cervix with a camera called a colposcopy and take a biopsy and see if anything looks abnormal. So she gets this pap smear done. It's abnormal. And the doctor's like, you have to come in and get this colposcopy and biopsy done. And she had said that the doctor was bugging her for a little while, it appears, and she was avoiding it because, number one, she didn't want to go through the pain of the procedure. And number two, she had a feeling it was something bad. So that's, and I'm glad that she's saying this out loud because that was really not good that she did that. So She finally decides to go in and get it checked out and gets the colposcopy done, gets the biopsy done. And it turns out that it does match whatever findings they saw on the pap smear, that there were cells that were highly atypical and suspicious of at least almost being cancer, if not being cancer. So now she's scheduled to have another procedure done called a cone biopsy. And a cone biopsy is when they go into the cervix so the cervix has a hole in the center, and that's where a baby would come out if you have a baby. And they essentially go around this hole and they scoop it out with a knife, cold knife
God.
biopsy with a scalpel blade. And when it comes out, it looks like a cone because they cone it out. And when we get that in pathology, then we're looking to see if any of these really atypical cells that are seen on both the pap smear and biopsy are to the point where they are cancer, and if they're invasive cancer. If it's invasive cancer, they're going to want to take out her entire uterus and cervix, because you don't want to take the risk of it growing back once you did that cone biopsy. Now, it's an interesting question because she's pretty young, right?
She's 38, yeah.
So she's 38. So technically she's still childbearing years. I know she had kids and she said she doesn't want to have kids anymore. So I feel like it's an easier decision. And honestly, like, I feel like if I had a high level of atypia that was almost to the point of cancer, I would just get my uterus taken out, to be honest, at my age, like not planning on having more kids. But unfortunately, this happens to women that are in their 20s, and then you face real problems, especially because doing a cone biopsy could weaken the cervix and cause problems for future pregnancies. Although people, even one of my best friends had this done and she had 2 pregnancies, but she did go early on both of them because her cervix just wasn't strong enough to hold it up. But like, I guess the thing is that it's good someone like Snooki is talking about this, because just because she has HPV, like, so do millions of other people. So it's not like she should be embarrassed to talk about this, but also how important it is that if perhaps when she had the initial pap smear done, she had the biopsy done and it was a lower grade and it wasn't cancer yet, she could have had treatment done and wouldn't be in a situation now where she's facing potential surgery and having a cancer diagnosis, which cervical cancer, especially if it's caught very early, can be a good prognosis, but it can be very deadly too if it's not caught early. So right now she's waiting to get this cone biopsy done to see what it shows. So if she has a type of cancer that's just confined, it's called carcinoma in situ, that it hasn't become invasive yet, sometimes that cone biopsy alone is enough to remove it all and cut it all out. We look for that in surgical pathology when we get the specimen to see if there's any of those atypical cells approaching where the surgeon cut it out. But like I said, I'm always a fan of, like, I mean, you know, there's always risks that come with surgeries too, but especially when it comes to cancer, I personally feel if you're able to get it out, I would just get it out, the organ of trouble, especially since she doesn't need it anymore. So I guess we'll hear more once she gets the results from this cone biopsy to see what further surgeries, if any, she needs to get.
Well, thank God we had the pap smear queen over here to explain all of this because, you know, it's not easy to understand for like a regular person like me. I do really like that she's going out there just being open about it and telling people, like, very honestly, I was very scared, which is why I didn't go in, and now I did, and like hopefully it doesn't turn out to be this horrible prognosis for her. And I think as in regards to possibly getting a hysterectomy, like, she has admitted, like you were saying earlier, that she's probably done having kids, but the thought that she can't anymore is still upsetting. And like, I'm sure you understand that as a person with 3 kids yourself.
To an extent. I'm done, so I don't care. I'd rather not have a uterus right now, honestly. Listen, like, I'm not talking shit on her at all, because and maybe it's because I had you when I was 15 years old, right? I just don't like going to the gynecologist. I don't like getting a pap smear. Like, I don't think anybody does. But I'm saying, like, I have, like, this extra fear of all of that stuff. I don't. So the thought, if they called me and said your pap was atypical and you have to get a biopsy, like, I know what that entails. It entails them cutting a piece of the cervix off that hurts when they touch it with a Q-tip. So, like, you understand, like, I understand being like, I'm not going to get this checked out. And I also understand being scared of finding out something worse. I mean, really, we see it in pathology so much that people are so scared of getting it taken care of, and then it gets so much worse because they wait.
Oh yeah, I mean, I think anybody could speak out to that about any possible issue they're having. I do find people are like you, very hesitant to go get a pap smear. Like maybe I'm a lucky person that I don't really feel it that much when I get them done. It doesn't bother me as
Well,
much.
wait till you give birth. You'll be quite aware of what that area feels like.
No, totally. Because like for me, the worst part of the appointment is when they stick the medieval contraption in you to open you up to do it. But no, and especially since I've been pregnant, I'm like, the pressure is quite different down there. So maybe after I give birth, it'll be a little different. But I think the important message here is you have to go to your annual appointments and like be on top of this stuff.
It's just like right now, if I said to you, Maria, you need to get this procedure in your eye, but in order for us to do it, we have to stick a needle in your eyeball. Like, you would be like, I mentally have to prepare for this appointment. I feel like the same thing with the cervix, just like thinking about getting needles and biopsies and things done down there. Just like, I want to be out completely. And typically when you go get a colposcopy done, you're not out at all. And that's the thing that could also be talked about with like men's health care versus women's health care. And just, a lot of women have come out recently and talked about how much it hurts to get an IUD put in the office without any anesthesia and stuff. And it's just like, some of these procedures that they want to do in the office, that they're just like, deal with it. It's just a lot for some women to deal with, especially those, like, I feel like, I mean, mine was self-induced, I suppose, because I got pregnant, but still being a teenager and having like doctors and in there and just like giving birth and stuff. It was like a traumatic experience as a child to go through that. So like, I want to be sedated during something like that.
I understand, because even when I had my egg retrieval, they're like, well, it only takes like 5 to 10 minutes to do the procedure, but we have to put you under anesthesia, because they're essentially taking the vaginal ultrasound probe with an enormous needle attached to the end of it. So do you want to be awake for that? I don't think so.
Yeah, I mean, and that they say that too with like the IUD and everything, but you're like, it also takes less than 5 minutes to rip someone's fingernail off, like, or pull someone's teeth out, like with pliers. I mean, just and listen, like, ultimately, it's just like, you'll survive anything, but it just is. I understand the stress of it. And I want to talk about this one story. This one pathologist used to tell us all the time about this person that she knew that had coughed all the time and got this really bad cough and was like absolutely convinced that they had lung cancer and wouldn't go to the doctor because they were so scared they were going to have to get surgery and this and that. And that person ended up dying. And when they did the autopsy, they figured out that that person actually had TB and never had lung cancer.
Wow.
So if that person would have went to the hospital and got treatment for the TB, they would be alive. And a lot of times people think it's worse than it is. And like, it's really, I mean, just if I could talk to Snooki right now, like, the advantages is that you won't get your period anymore. So like, you could get a hysterectomy and it sucks to get that diagnosis, but then you could get the surgery done. And I mean, 38, you're still getting your period, maybe for another 10 years. Like, look at it on the bright side.
I mean, a chick on another podcast I listened to had a hysterectomy, I think 2 years ago, but she was having serious issues going on all the time. And they were like, this is basically all we could do for you at this point. And obviously it's really scary to get there, but now I feel like 2 years in, she's living like a great life, you know?
Yeah.
So
And I feel
it's
like most people that get that done don't regret it at all.
yeah, so it's obviously scary and you want to mourn that part of your potential future motherhood or your womanhood in general that might not be there anymore, but if it could be a safe bet that you're not going to have a serious illness, I definitely agree with you that she should go forward with it.
And maybe she could be like Elton John and keep a piece of her uterus in a jar at her house. Like, apparently, Elton John, he's so cool. Like, I love him, but this just made him even cooler. He got his knees replaced, both of them, apparently, and he decided to keep them. How did we miss this story?
I don't know. So this documentary about Elton John came out on YouTube. Maybe that's why, because it came out on YouTube
Oh, okay.
in the fall. But he revealed in it that he had his kneecaps removed and then had them turned into jewelry. So he had his left one removed, then his right, and he asked the surgeon if he could keep them. They thought it was, an unusual request, but let him do it. So he ended up having the right bone fragment surrounded in gold and turned into a necklace. And since the left one was smaller, he had that one turned into a brooch.
I love this so much. So we do talk about, getting back to Snooki, right? Like, and just making my joke, because if her uterus was taken out and sent to pathology for cervical cancer, I doubt that anybody would actually give her a piece of it, because cancer cases we really want to keep and look at under the microscope. There is a possibility, I guess, if someone wants to take a small piece of the wall of the uterus and give it to her, but she's definitely not getting her uterus in a jar, as far as that's concerned. However, with Elton John, one of those specimens is considered to be exempt. There's a whole list of them, like fat from plastic surgery and teeth and things that like we could throw out or we could give back to people, gallstones, things like that, hardware, surgical hardware. And one of them is knee replacement tissue is not always considered something that needs to be examined under the microscope, just because some hospitals do so many of these procedures every single day. I mean, like, you probably know so many people that have had knees, shoulders, hips replaced, right? So what happens is they sometimes do them both at the same time, but sometimes they don't, depending on the person that's getting it done. And Elton John's kind of a big deal and he has to be mobile. So they were probably like, all right, let's do one at a time kind of a thing with him. For osteoarthritis is the most common reason. And that's probably why he got it done. I mean, he's old. And what happens is you have your bones. The knee is kind of a complex joint because you have your femur and you have your tibial bone too that work as part of the knee. And then you have the patella, which is the kneecap itself. And what happens is that there's a padding over top of the bones called articular cartilage, which rubs away, which is what osteoarthritis is. And when that rubs away, the bone rubs against the bone, and that's where you start to feel that pain, and that's why they take it off. But when we get that specimen in pathology, so they cut off the end of the femur, they cut off the end of the tibia, and they give the patella bone too, and just some soft tissue with the knee. When we get that in pathology, we just look to see if that cartilage is rubbed off. And if it is, we just do what's called a gross examination, or we just look at it with our eyes and say, this person has eburnation, or that's what it's called when the cartilage rubs off. And then we throw it in the medical waste, right? So in theory, like, we could give that to a person if they really wanted it. I've never had anyone actually ask for their knee back. I've had people ask for their hardware back if they've had their hardware taken out for knees, but not their actual bone. So when he sends this bone to the jeweler was saying that it was very porous, which I think is interesting because that means that, like, his cartilage was rubbed off a lot and then his bone was rubbing a lot too. Like, it was in pretty bad shape. So they had to do certain things to it to clean it off and to get it to be like, they put like an acrylate on it. So it was like, they were saying it was similar to a pumice stone once they cleaned it off and everything.
Yeah.
But it looks really cool. They kind of surrounded it in gold, and it looks like something you would see like a one of these natural stone necklaces or something like that. So I was like, this is so cool.
I find it funny you're saying it looks cool, and he did, well, maybe because he said it reminded him of an Egyptian artifact, but I'm like, this is so ugly.
No, it's.
I,
I don't think it's ugly.
I
I think
thought
it
the
looks like if you got like, when you go to, one of those places that sells like amber necklaces and stuff, and they have those cool slices of stone. Like it just has like a vibe like that.
No, it has that vibe, but I also think those are ugly. I think that the brooch is really cool looking because it has like jewels on it and stuff. Also, like speaking of keeping stuff, funny side note is that I was touring the hospital I'm going to be giving birth at last week, and I ran into Jamie. We were talking about you, and I was just like, oh, my mom's probably going to want my placenta. And we were laughing about it. So then I'm telling you about it on Friday, and Gabe comes in and is like, wait, what? And I'm like,
Why
yeah,
is he saying what? Like Lillian's placenta was in our fridge for like a week.
I'm like,
while I
your
was in the hospital.
grandson's placenta is going to be in your house. Get over it.
Get over it. Wait, let's talk about this really cool. Finishing up with Elton John though. So the jeweler engraved in the kneecap in Latin, I will no longer bow to any man. Like how great. I just love this.
No, the whole thing is super cool, and the fact that he did it.
He's so eccentric, and like if you have the money to pay to get that done, like hell yeah, I love it.
And he's just forever going to be this fashion icon, right? And now he's hoping these last for centuries. I mean, they do look like something you would see in a museum. And can you imagine the auction, like, I don't know, in like 75 years when they're like, and now Sotheby's is auctioning off Elton John's kneecap jewelry in like a century.
It sucks
This
because
is
I was going to
insane.
tell you that I would really appreciate this gift, but I don't think we're ever going to be at a Sotheby's level gifting each other at any point in our life. So
Maybe if
if
this
he
show
wants to
really
leave them, if he wants to leave them to me in his will, that would be very nice because I would really appreciate it. But
or if the show really takes off, so you guys make sure you leave us 5-star reviews and like our YouTube channel.
yeah,
so we could buy
that
this
definitely will happen.
kneecap.
So Maria could spend $1.5 million on Elton John's kneecaps, so I could put them in my collection. All right. So speaking of other weird body parts getting cut off,
Yeah,
this is a very unusual story.
So this mom is suing her daughter's middle school after her kid's fingertip was accidentally severed, and then her teacher threw away her fingertip, which prevented it from being sewn back on.
So this kid's in middle school. They're like my kid's age.
Yeah, roughly, like preteen.
Like at school and got their hand accidentally stuck in a very heavy door that cut the fingertip off, which you could see happening with some of those fire doors are really heavy.
Oh yeah.
I don't understand. I mean, I guess the girl went to the hospital and she had a broken fingertip and her finger was partially amputated. So clearly there was some kind of commotion when this happened. And it's possible that they called 911 or brought her to the hospital right away in not paying attention in the confusion. And some poor janitor just got stuck cleaning the blood up off of the door and just cleaned it up and like threw the chunk of tissue in the trash. I mean, like, I don't know. I don't 100% blame the school just because when something like that happens and there's a child freaking the hell out because their fingertip is like bleeding all over the place, it just would take a lot for a person to be like, is the tip missing and is the piece of it still at the scene? And let me bring it into the hospital. Like that would be the best case scenario. But I just think of a bunch of frantic people freaking out that happened, that it wasn't the first thing on their mind. And maybe since it was such a small part of the tip, they didn't realize that it had even cut off.
Yeah, that's what I was thinking. Maybe they didn't realize it. It seemed like this was a pure accident too. She was in the bathroom. She was leaving. It seemed like another student accidentally closed the door, not realizing her hand was still there. And that's when this happened. I think this lawsuit, I don't know how it's going forward. I mean, they're seeking $300,000. They're claiming that the school district was, quote, negligent, careless, willful, wanton, reckless, and grossly negligent. Like, it was an accident. And
but what's the fee?
How much
like,
they want?
Like, yeah, like, where do you get the number of $300,000?
I mean, I don't really... Again, this is a question we ask constantly. How are we coming up with these figures? And I guess the question we have is just, are they suing about the entire incident or just because they threw the fingertip out? Because if it wasn't if it's just because they threw the fingertip out, I guess they have a case because that did happen. But at the same time, I think you're worried about the kids' well-being, right? So you're not worried about the fingertip. There might have been so much blood, like you're saying, they might have not even realized what happened if it was a small portion of it. So I don't really understand where they're coming at with this unless they're just trying to get the medical bills covered.
I mean, like, and what is fingertip? Because as a woman, the fingernail is a very important body part. So if the fingertip came off with the fingernail included and she no longer has like her whole entire distal fingertip, then I think that is something to consider, maybe, just because I mean, you would, if her finger is that much shorter and everything, she could have lifelong, I mean, she'll be fine, she'll survive, but like it's kind of a lifelong deformity in a way, and the fingertip's shorter, so your grasp can be a little bit different and things like that. But I just feel like if her whole entire fingertip got amputated and her nail and everything was missing and her finger was actually shorter, that they would have noticed that. I don't know. And if like if a janitor saw a fingertip with like an actual fingernail on it, it would be a little bit more. I'm just thinking that it was like a pinchy, just like on the tip, and
I guess
and like this money's just kind of like not necessary.
Yeah, I guess these are the questions we need answered. Because if they did knowingly see the fingertip on the ground and we're just like, okay, we're just going to throw it out, yes, the lawsuit, in my opinion, is worthy at that point. But if it was a small piece, they really didn't see it, they didn't know what happened, it was purely accidental, I don't know how this family's going after them.
Like, if I had to get my nails done and not get one finger done, it would really ruin things for me. It would ruin a small portion of my life.
You would figure it out.
You can't figure it out. What would you have to wear? Like a clip-on? Like one of those ones that used to come with a game when you were a little kid or something? Like you can't put a fake nail on skin like that.
People are born with congenital anomalies that could have a shorter finger. Like, it's not unheard of. People live with it.
I understand that. But this was an accidental thing that happened. That's all I'm saying.
This episode is brought to you by The Gross Room.
Guys, this week's high-profile death dissection that we will be posting today is on Elizabeth Holmes and Theranos. That is her company that she started. I guess we would say it was a fake blood collecting company, right? A very, very crazy case that we're going to get into later on in the week on this show. But for this purpose in the gross room, we really went into all of the details about how this woman was able to basically trick the world into believing that she had discovered and invented some kind of revolutionary blood testing system that was tested on actual real patients, that turns out that the whole entire thing was basically fake and fraud. And just, how I really go into my part of it with how blood collection normally happens and what happens with lab regulations and everything like that, and how she was somehow able to bypass all of these things that we consider are agencies that are put in to keep us safe as Americans. So how was she able to just bypass all of that stuff? And it's really kind of shocking. So check that out in the gross room.
Head over to thegrossroom.com now to sign up. All right, so last week, this fireman flagged down police and asked if they could do a welfare check on his wife. They get to their house. They find her murdered in this completely gruesome, bloody scene. So after questioning him, he allegedly confessed to killing her with an axe, and now reports are saying that moments before he killed her, he read her diary, which revealed that she was having an affair.
Like, you hear about this sometimes, of people, of like diaries getting read or getting leaked. Like, who keeps a diary?
Well, a lot of people journal, but I don't understand why you'd write something about having an affair in it.
It's like seriously the most bizarre thing that anybody would put something like that in writing, especially in, listen, like I might sound like I'm victim blaming, which is not cool at all. I don't even understand why. I don't understand why any person would do something like that.
Yeah, I don't
It just is.
understand.
It's just very bizarre to me. Like, and you're in the house you're living in with that person. If that is even true, that was what happened.
Well, yeah, of course that's a detail we don't know for sure, but I think the police said they did recover a diary, but it hasn't been 100% confirmed if that's what the contents of it were. So, I feel like, I understand people do journal, and I understand a lot of people do it actually, but I don't understand putting like things that are damning like that and could come back to haunt you. Obviously, I'm not saying she had a right to die because of it. I'm just saying like it's odd to me that you would put that in there for somebody to maybe find.
Yeah, that's how I feel. And on top of that, we have to consider, like, I could say with certainty, although I guess people could come back to this video and listen to it when if this does happen to me, that I don't think that my husband, even though he's a firefighter and has tools like axes, I don't think that he would ever bludgeon me to death with one, because like he's never shown any kind of signs of behavior like that, right? But this woman, there's just no way that this guy just did this and like never has acted like a crazy person before this. So that's what makes me even more question, why would you have something like that laying around that could further set a person that's mentally unstable off like this?
Well, yeah, I want to say like the cops are calling it a horrific domestic violence incident. So was there a history of domestic violence going in the house? At first I was trying to think like was it a crime of passion? Did he read that and immediately black out and do it, right? But then they're saying there's firearms in the house. So like why is he going to grab an axe when he has access to a gun which could be quicker, you're thinking, if it's something really fast?
Well,
Really all the
because that's
details of this don't really add up to me at all.
because when you're pissed and a crime of passion and overkill, you wouldn't use a gun. It doesn't give you the satisfaction it does of using an axe. And I mean that happens all the time with murders and things like that. Um it's interesting. One thing I wanted to note was that I saw some of the articles said that she had died from blunt trauma, and I would have to disagree with that assessment. Of course, I didn't see, because honestly, I guess in theory, if he was holding an axe by the axe head portion of it and using the stick to beat her, that would be considered blunt trauma. But when you beat someone to death with an axe, that's not necessarily blunt trauma. It's a combination of blunt and sharp trauma, because the axe head is very, very heavy, usually made out of a very heavy metal. So that would be the part that would cause blunt trauma. But then the head of the axe is pointy, that would also cause things that would look like a sharp wound from a sharp weapon like a knife. So the wounds, they're very specific, called chop wounds, that are seen in cases like this, and they're not the same thing you would see beating someone with a baseball bat, but they're also not the same thing you would see beating someone or stabbing someone with a knife. Because when you are stabbing someone with a knife, you typically don't see a lot of the changes that you would see with blunt trauma, which would include lacerations or tears that you would see. Because when you get cut with a sharp knife, that's an incisional wound. We go over this all the time. It's not a laceration. A laceration is when your skin tears from trauma. So you don't typically see that in stabbing cases, but in this particular case, you would see that because it is a combination of the wounds. You also, with stabbing, you wouldn't see things like abrasions as much and bruises as much, like things that you would see when you think of doing blunt trauma to somebody. So it just has a very specific appearance.
Well, is it possible that he beat her to death and then hit her with the axe after?
Yeah, it's possible, but you would still see similar kind of things depending on what was done. But I just feel like so much more is going to come out about this case. I mean, like, it is, you could see someone being very upset in the heat of the moment and shooting someone, but just to do something like that is just, it's just very extra, overkill, impulsive. And I'm sure we're going to hear a lot more about this guy's history.
What if she was keeping a journal and she was trying to write a smut book and she was writing all her ideas down and he took that as her having an affair?
Well, I still would say, I mean, like our friend Jen does that all the time, right? Like she makes joke smut books all the time. Like if her husband came across that, that wouldn't be his first instinct, right? To beat her to death with an axe. Like there's some level of like he's not all there, whatever. Even if you do catch someone cheating, that is never an excuse to do anything like this.
Yeah, I mean, I think they were definitely having problems before, and if it is true, she detailed an affair she was actually having in a journal. I think that's odd to write something incriminating like that down, but it's obviously his fault that he responded that way.
Yeah,
And she
of
didn't
course.
deserve to die over it. So like I think we're going to see a lot more come out about this guy. And they've been married for what, like I think 15 years about. So what happened in
and
the
it
rest
looks
of their
like
marriage?
the fire department only put out a statement saying that he was on like leave or something.
Yeah, administrative leave.
Administrative leave. But you ever notice, and sometimes in cases like that, like if they really believe that their coworker and their employee is like a decent person, they would put out a statement saying, so and so worked for us for this many years and has always been an upstanding, employee of this fire department. Like they're very like quiet about it, which makes me think that this isn't a surprise, maybe.
Well, I also want to point out that he's being held on $2 million bail, which is only $1 million more than the Pennsylvania grave robber, Jonathan Gerlach, even though this man allegedly confessed to murdering his wife with an axe.
This is another thing, too, like, and I know that we had this answered several times. I just still can't wrap my head around it. Like, I think that this guy, if I found out that my neighbor beat their wife to death with an axe, like that guy is so mentally unstable. I don't want him to ever be able to just go home and be on house arrest until his hearing date. Like,
no way.
That to me, just, I feel like he's someone that needs to be out of society for right now anyway. So, I mean, listen, he's a firefighter, and I doubt that he'll ever come up with $1 million to get himself out of jail anyway. But you never know. There could be some lunatic person that wants to donate money to him to let him out. Like, it's not impossible, and the fact that it's even possible just sucks,
Oh, yeah. All right, so there's a new flesh-eating parasite on the scene, and it may be coming towards the U.S.
So it's not really new. It's been here before, but I guess in the United States, at least, we've gotten rid of it. But now they're seeing cases of it in Mexico so close that it's coming and approaching Texas. And they are saying now that they're just putting out a warning because just give it enough time and it'll cross the border into the United States and it could potentially become a problem. So this parasite comes from a fly, and it's called the screw worm. And I guess it can go on any kind of host, particularly cattle. That's what they're worried about, I guess, especially because Texas produces the most amount of cattle that is in the entire United States. So they want to make sure that it doesn't go through the cows there, and it could land on their mucous membranes or their skin and cause these large necrotic or flesh-eating wounds that if they do not get treated, it could like take down a whole entire cow in a week and kill it. So the concern is with humans is that humans are also warm-blooded animals that could host this particular worm too. So they're just putting the alert out there to just say like, hey, if you just so happen to get this weird wound that looks like it's not healing, you better go get it checked out because it could be this new or this reemergence of this parasite we thought that was eradicated from America at this point.
Yeah, I understand the concern with Texas because, I mean, I'm going to preface this with my knowledge of how ranches work is strictly tied to the show Yellowstone. But other than that, I would say, like, they have these cattle spread out on these enormous properties, and I doubt they're like checking their full bodies every single day, right? So if it could take the cow out in as early as a week, that's very worrisome.
Yeah, and it's hard with things like this that are fly-borne parasites. It's just very hard because like think about this. When you're outside, it's just like the same with mosquito-borne illness and stuff. Like how do you prevent yourself from getting bit by a fly or a mosquito? It's just very hard because they're in the air and they're quiet and they,
Yeah, you
they
don't even know they're
multiply
coming.
like crazy. So there's going to have to be a lot of things. I mean, obviously the reason that they brought it up is because there's been 7 people who have died from it now, which is not anything to panic about in the grand scheme of how many people are in the world. But they've also tested a lot of cattle that have been positive, over 1,000. So they want to just kind of try to control it before it becomes a bigger problem. You know what I mean?
Yeah, and I found it interesting that they were saying they had previously eradicated these, but they keep finding their way back somehow.
They're very virulent guys, I guess. I mean, I'm just like, there's another virus too I've been hearing about that they've been talking about. So it's like, and I don't want to alarm you guys because I feel like sometimes I mean, like obviously it happened with COVID, but since COVID, you just always have to take into consideration like how much play all of these news organizations got from COVID. The same thing just happened this week with the snowstorm around here.
Yeah, I just texted you about that because I'm like, the way people are acting is like, we're going to be in this post apocalyptic era with this snowstorm, which, by the way, I think my town only got like 7 inches or something, which is a lot of snow. And it did disrupt life to an extent, right? But they're acting like everybody's power's going to go out. I went to the grocery store last Wednesday, which was days before the snowstorm. They had like nothing there. It was insane.
My neighbor went to the grocery store and took video of Wegmans. There was no bread in that whole entire huge area. Like, not even like Pepperidge Farm cinnamon bread. No bread at all and no produce at all in the whole entire grocery store. And like you're just like, what is happening right now? Bread is the weirdest thing because bread is like the most perishable item, right? Like why wouldn't like the canned good aisle be like empty or whatever? I don't understand it,
No, it was like lunch meat, bread, milk, eggs, all extremely perishable
but
items.
it's and you know what else is funny too? I noticed my husband was outside shoveling literally, and I get news alerts and see posts online that are talking about the next storm that's coming this weekend, right? They're
Yeah.
already trying to hype up another one, and it's just like obviously because everybody's like, "What?" and clicks on it, and that's what happens. Like going off track, but that's what happens with these stories because everybody is so scared of something like COVID ever happening again that every single time they post about this like new bacteria or new parasite, like they tried to do it with monkeypox and like I just try to go through and explain what it is, and hopefully you guys could just figure out that like it's really not that big of a deal, but just it could get someone sick. So just if you live on the border in Texas, I guess suppose it's more of a an issue for you, but I don't think that this is going to be such a problem that like we're never going to have steak again and every person's going to have like flesh eating lesions on their hands.
I mean, I think with COVID too, it's just like I'm sure it's one of those things now. You know, like everybody knows where they were on 9/11. Everybody knows where they were the day the world got shut down from COVID. Like we were at a party. And everybody started getting alerts on their phone that their works were shut down and nobody could leave their house as of like the next day. And everybody was like, "Yeah, fucking right, I'm gonna do whatever." And then you saw what happened. Like we were encouraged not to leave our homes for months at a time. And meanwhile, I'm like, well, I've been hearing about this for like 4 months, so I was prepared for it. But a lot of people had no idea about it. So I don't really know. I think it's definitely like the news is definitely latching onto the fear mongering and they're definitely getting clicks. And we have to remember like they get money based on clicks, based on the articles. So of course they're going to try to amp everything up so people are looking at the articles. We live in the worst world ever right now. Seriously.
It is. It's like it's just sad cuz it's like you can't, and maybe it's always been like this and we're like getting smarter now and realizing it. But you don't really ever know what to take at face value anymore, so
Yeah. All right.
Turn to this show to get the real deal. Okay. Um this all right, woman, this is labeled woman was euthanized against her will. I mean, you could say the same exact thing about the firefighter's wife who was just killed. She was also euthanized against her will, right? Like, what happened here?
Well, I guess they're using this on a technicality. So this man is being accused of having his wife euthanized against her will because he did not want to take care of her any longer. So I think most people would probably call the terminology murder, but we'll get into the specifics to see why maybe they're phrasing it that way. So this woman is in her 80s. She had complications after a coronary artery bypass graft surgery. She was declining very quickly, and her husband began caring for her. So as she got worse, the husband struggled to take care of her. She had expressed interest in MAID, which is medical aid in dying, which is legal in Canada. But when the assessor got there, she was expressing regret and said she no longer wanted to go through with it. The very next day, they go to the hospital. She, at that point, wants to go on hospice. They get denied for hospice. So the husband calls the MAID assessor again, or the provider again. They send out a secondary assessor who then agrees to have her go through with it. So I guess when these cases go through, a judge has to review them. So the first judge was like, wait, I thought she already backed out of it. And the second judge is like, no, I'm approving it. And then the MAID provider declared that her situation was urgent. So they sent a third assessor before the other judge could have a look at the case. They agreed with the second assessor, and then she was euthanized that night.
Yeah, I mean, clearly, I don't know how things work in Canada because I guess my first thing was if she, I don't understand what denied hospice means. I
Yeah,
mean,
I
like,
don't either.
I don't know that's something. I don't understand that because hospice is just special care to make sure that you're comfortable and as you're dying. So I don't know why she would be denied that other than maybe she wasn't that bad. I don't know how things happen in Canada. So I guess I could see from the perspective of the medical aid in dying people that maybe they thought she had changed her mind again because she was denied hospice and just didn't want to live anymore. But I mean, they're looking back on this case and looking at other similar cases and just saying like when they send over those people to come talk, the husband was there the whole time, and it seems like he was the one that was talking about having her do this euthanasia, and it doesn't really seem like she personally expressed it herself. And then it brings up questions of like, when you're getting interviewed for that process, should you really have someone in the room with you that might be pressuring you, like a husband that's just kind of like, I can't do this anymore, it's so hard to take care of you, I have to wipe your ass, I have to feed you all the time, like,
No, and I think this is
it's a lot. It could be a lot for a caregiver, especially like a male one that is old and is just like never used to taking care of a person like that. Like maybe she took care of their family the whole time. And
well, I think this is a large ethical concern people have with this because they're worried about people either persuading or taking a person that can't really communicate that well with certain conditions like dementia, or if they're just declining really badly, and just like speaking on behalf of them. And this is really not a case where that should be allowed. They had cited one case where a person wanted medical aid in dying and that they signaled their desire to have it done by squeezing their loved one's hand. I mean, how did they even allow that?
yeah, I mean that's going to be all of the ethical questions that come up with this, and in Canada is like really lax with it, right? Like you could get it if you're depressed in Canada and things like that, whereas in United States it's a little bit more strict as far as the guidelines where you could be eligible for that. But yeah, I mean, it's kind of a sad story, especially because this comes out now, and then they're older people, but they probably have kids and grandkids and stuff, and you don't want this to be like final memories of what happened with your family. And you're also sympathetic though towards the husband, because I do know a couple people who have been caregivers in situations like that, and it's a lot for people to deal with, even if you're a young healthy person that to see someone that you love like disintegrating and dying like that and having to take care of them on top of just maybe not being the best person for the job and then getting denied help, which would be hospice, to have like a nurse come over and have the medication for pain management and things like that. I mean, you could just see why the situation got ugly like this.
Oh, totally. And I think a part of it too is that sometimes there are caregivers that aren't good-hearted people that genuinely are complaining about it so often in front of the person being cared for that the person being cared for then starts getting the mentality like, I would be better off dead than having this person suffer because I'm disabled in some type of way. So I think this is why they are supposed to do the assessments and make sure the person actually wants it. But
No, I
clearly
mean,
something
and
went
that's
wrong
a
in
good
this
point
case.
that you brought up too, because like you feel you do. I imagine I've never been in this situation, but you imagine that I'm just trying to put myself in this situation that Gabe and I are older people, and like I need help going to the bathroom every single time, and just you know what I mean, like because I hate that for myself. Like I don't like to be a burden on people, so you could feel that you would feel like guilty about have someone having to basically like give up their whole life to babysit you and to like take care of you all the time and things like that. So
I mean, on the smallest scale, when I had my surgery, I felt awful that you and Ricky had to like help me get up off the couch, and that's like not a full time thing. That was what, 2 to 3 days? So I can't imagine feeling like that every single day of your life. And then, especially if you have somebody that's not a very nice person or not sensitive to your situation, that's complaining all the time and making you feel guilty about it, it's going to affect your mentality.
yeah, I totally see that.
All right, on to your questions and emails. If you guys have questions or stories for us, please submit them to stories@motherknowsdeath.com. 1. Do you review CT imaging before cutting for autopsy to know what you're getting into?
Yeah, if we have imaging in the chart, yes, I would always look through it. Not necessarily the images themselves, just because oftentimes, unless it's very obvious, I have no idea what I'm looking at because I'm not a radiologist. But definitely would read all of the imaging reports and, obviously any previous surgeries, or call anybody if I had any questions about what was done. I think it's just kind of dumb to not do that. If you have someone's chart and all of their medical history and testing, like why wouldn't I look at it first? It just gives you more information to go in before you go into the autopsy. But as far as cases go, like at the medical examiner's office, they oftentimes don't have access to a lot of that stuff. So sometimes you have to go in blindly. Sometimes we get patients that come into the hospital and like die as soon as they get there. And sometimes we don't have access to it. But whatever we have access to, we definitely look over in detail before starting the autopsy.
Wouldn't you say sometimes it might be better to not have those so you're not swayed a certain way going into it?
No, because I would just like to know. I would just like to know everything going in. I don't think that it would. Because a lot of times, like if a person had a previous surgery or something, like you just want to know what you should be looking for. And the best thing to do when you're doing an autopsy too is to document things that are already known. So the person had their appendix removed already. So when you go in there, you should see that their appendix is removed, and like find the clips where the surgery was and their gallbladder was removed and things like that, or a piece of their colon. Because if you just open someone up, I mean, especially a lot of the autopsies that I've done have been really, really sick people that have had like 10 surgeries, and like they're just really, really, their anatomy is just completely distorted. Like I want to go in there and know what the hell was done to them. Is that supposed to look like that? Is that not supposed to look like that? Like what surgery did they have? What year did they have it? Why? Because think about that too with bowel surgery, especially when they start going in and like taking chunks of people's bowel out and rerouting it here and moving it here. Like it's just better to know what happened. And like I said, like sometimes you just don't know, and then you just have to be like, okay, well, I'm looking at this right now and it looks like this person had this. But you also want to know for example, if a person had like ulcerative colitis or something like that, because that increases their risk for colon cancer, or just different kinds of diseases and surgeries might key you off onto something else that's going on in a different part of the body. So it's just like, I'm like, the more information I know, the better kind of thing.
All right, next is from Jen. On your January 20th show, you had asked if there was a legal limit placed on radiologists prohibiting them from reading more than X amount of hours or exams per day. Shockingly, there is no limit. The RADs explained that the reason they are forced to work 100 plus hours per week during their residency is to eliminate the weakest of the herd and only the strongest and most resilient move forward. That being said, and this next part will scare the bejesus out of you, they also said that even with a full night's sleep and years of experience, they could still miss things. I can vouch for this firsthand many years ago when I spotted a skull fracture on a 15-year-old boy that the radiologist read as negative. Keep asking questions that give me a reason to bust in the reading room at work and bug the crap out of the radiologist. It's bad enough I already stumped them with mystery diagnosis Mondays.
I love that. No, this is really good information because, like, we don't, obviously, like, I've never worked in radiology and I just have a lot of questions about it. And that's really interesting that there's not an amount that has to, that, you know, that you have to read in a certain amount of time. Let me tell you something. With the whole cytology thing, that was never a thing. Like, cytotechs used to be able to read as many slides as possible, and it got such a business. It got to the point where cytotechs were like taking slides home with them after work, and they had a microscope at their house and they were continuing to work for more money. And the reason that there was a huge limit put on it was because a cancer got missed on a pap smear by some important person, his wife. And then that's when they started putting all of these limits onto how many slides a cytotech could look at a day, because apparently she had cervical cancer or precancerous cells that were missed on pap smear in one of these situations where people were looking at slides, you know, off hours after looking at so many a day. And he was in a position to put forth legislation to stop that. So I'm assuming if something like that happened with radiology at some point, that something like that could be done too. But this is another question for you, actually. Like, what kinds of checks and balances do you have? Because you're saying a radiologist missed the skull fracture, but did she say what she was as a profession?
I don't think she did.
A radiology tech, or possibly even a nurse or somebody looking at it. Like, what's the backup to catch things? Because that's typically, like, most things in the hospital have a backup. Pap smears, the thing with pap smears is they don't always, like, let's say we look at 100 slides, like, every day you would do like a QC, so you would just go look at a couple of that person's slides and just make sure they didn't miss anything. But like, if the other slides weren't looked at, then you could miss it. So I could see that.
I just think it's ridiculous that something like that had to happen for legislation to go through, because it's like, how many people that didn't have means or power did that happen to? And then it takes it happening to somebody like that for something to actually be done.
Yeah, I mean it sucks, but that's the way things are. And I mean, it was good that it got done eventually, especially because during that time period, that was before like HPV testing and stuff, like the pap smear, and that was before all the special like monolayer pap tests and everything. This was back in the day where you literally just took like a cervical scraping and wiped it on a slide. It was chunky, it was messy, especially like if a woman was bleeding either from period or just from the procedure itself. There was just such a higher probability of missing cells anyway. So, and that was the only thing that they had for a while to really screen for cervical cancer. Now it's like they could do the HPV testing and the thin layer, everything. So they have computers that could read slides now. It's just like a lot different. But back in the day, it was important.
All right, last is from Alyssa. Thanks for the entertainment of MKD each week. My kids tease me constantly about my gross room podcast and always make it dramatic. What are you listening to? A few weeks ago, I listened to the endometriosis episode with my 11-year-old. We have really open communication and talk a lot about puberty and what to expect. The episode brought up some great talking points, including it's not comfortable to have your period, but it's also not normal to be bedbound each month. Preach. Women don't talk enough about endometriosis, so I'm glad you had this episode to bring up an important topic. I was able to better explain what is normal with a period and what is definitely not normal. I encouraged her to advocate for herself if she was feeling more than normal cramping and bleeding. On another note, Ricky cuts my teenage son's hair. I put the connection together when I saw Maria like the barbershop and pondered how many redheaded barbers named Ricky could there be. At a recent mom's night out, I realized how many local moms have Ricky cutting their son's hair. We chatted about how great he is and always makes the effort to chat with the boys, even if they don't say much back. I made sure to tell them about Mother Knows That. Thanks for a great show and awesome topics.
That's great. I love that.
I
Yeah,
like-
it is like, because I have like, obviously, aside from Maria, I have two pubescent girls, one of which had just got her period recently. So like, it's really important to talk about, to just make it like normal in the house.
Yeah.
The biggest thing is normal with the dad, because like my husband's in a house with all girls, and like that can't be a subject that's taboo for him to discuss. And
No, she needs to be comfortable.
one
knowing the both of
awesome
you.
thing about Gabe that I knew he was going to be like a good girl dad was that when I started dating Maria, when I started dating Maria, Jesus Christ. When I started dating Gabe, Maria was 13, and she had like a situation at school where she got like blood on her pants, and I remember Gabe went to school and brought her pants. And I thought that was so cool, because I was just like, this guy is like a firefighter and he's kind of like a man. And I just was like, this is like, he's not weirded out by this at all to do this to someone that, that he had just met, child,
Yeah.
you know what I mean? So I thought that was cool. And, but yeah, it's important for it to just be not weird, because they don't know what's normal and what's not normal. And like, they should feel comfortable telling you, you got your own life, so you're not paying attention to like, how many days are they bleeding? What's their flow? What's this, that,
Yeah.
So you really should just like, just be able to talk about it like it's normal and it's not anything that's like gross or something,
We're very glad you like your haircuts.
Yes.
All
We
right,
know
guys.
Ricky can talk.
Ricky can
doesn't
talk.
stop talking.
And we joke that he picked the perfect job because there's a running joke that all Kane men love staring at themselves in the mirror. So he gets to look at himself in the mirror all day and talk to everybody. He makes friends wherever we go. Sometimes it's a good thing. Sometimes it is the worst thing ever. Like, you don't have to talk to every stranger you make eye contact with.
That would be the worst.
You've witnessed it at the Phillies
know.
game. It happens a lot. All right, guys, don't forget we have our Valentine's Day merch collection on the doormattershop.com. You can also find that link in the gross room or on the description of this episode. We also have tickets for our City Vineyard show in New York City on February 21st for sale. That is only in a couple weeks, which is crazy. It's going to be awesome.
I'm excited about that, though. I haven't decided what I'm wearing yet. Did you?
I bought a dress, but I might need to repurpose it for another thing we have.
See,
So-
I wasn't going to wear a dress because it's probably going to be like 10 degrees out.
Well, clothes don't fit me right now, so I'm having kind of...
You sound like Mean Girls, like, this is the only thing that fits me.
That's how I feel. I'm actually going to pull that meme out of, what's it, Regina George saying it? Like, none of my pants have fit me since, I want to say, around Christmas. And now my leggings are starting to not fit me. I'm about to exclusively be in pregnancy pants, which they're kind of awesome, I'm not going to lie, so whatever. But I'm having a hard time because now my shirts are starting to not fit because my belly's getting too big. And none of my dresses fit me. I mean, I was supposed to wear the dress you wore to my wedding, to Dee Dee's wedding, and it wouldn't even zip up my back. So we're having a hard time. We're having a dress emergency this week because nothing fits me. But whatever. It is what it is. But what are you gonna do?
Yeah.
Long story.
It's not like you're just gaining weight like Regina George was and don't know why. Like,
Yeah, I
it
mean,
happens and it'll go away and you'll be normal again.
I have a whole child growing in my stomach, so I'll give myself a pass. But like, I am really having a hard time finding clothes that fit me and aren't the ugliest things.
Are you
ever.
regretting not doing a surrogacy?
No. No. As I said on the YouTube live on Friday, this is the coolest thing that's ever happened to me, but it is a weird thing seeing your body change and now feeling a person moving around inside. It's very weird, but it's also super cool at the same time. But to answer your question, I don't know what I'm wearing to City Vineyard yet, but hoping some of our true crime friends stop by so people can see them, and we're always going to have the most outrageous stories to share.
Yeah, it'll be fun. It'll be really fun, so check that out.
All right, guys, please head over to Apple or Spotify and leave us a 5-star review or subscribe to our YouTube channel. And if you have stories for us, please submit them to stories@motherknowsdeath.com.
See you tomorrow, guys. Thank you for listening to Mother Knows Death. As a reminder, my training is as a pathologist assistant. I have a master's level education and specialize in anatomy and pathology education. I am not a doctor and I have not diagnosed or treated anyone, dead or alive, without the assistance of a licensed medical doctor. This show, my website, and social media accounts are designed to educate and inform people based on my experience working in pathology so they can make healthier decisions regarding their life and well-being. Always remember that science is changing every day and the opinions expressed in this episode are based on my knowledge of those subjects at the time of publication. If you are having a medical problem, have a medical question, or are having a medical emergency, please contact your physician or visit an urgent care center, emergency room, or hospital. Please rate, review, and subscribe to Mother Knows Death on Apple, Spotify, YouTube, or anywhere you get podcasts. Thanks.